From the moment that you get the call that you have cancer, you don't think of life beyond cancer. You think of it the moment that you want to remove the cancer and actually make final plans for your life, get things in order.
The good news for Katie and so many other breast cancer patients, final plans didn't have to be made. She's already a 10-year survivor. But at the time, chaos reigned.
I look back at those days, and in that moment, those 48 hours to make a decision, there's a lot of confusion and distress, and if you don't know the information of restoration and what your options are before, it's just too much to process in those moments.
They get the diagnosis and they go and have a mastectomy, so they're not knowing what to do. Women with lumpectomies don't know what to do. So what we're finding, there's a lot of regret after the mastectomy's been done years later. They're like, I wish I had known.
So BRAVE was born 5 years ago. It stands for Breast Cancer Restoration Advocacy and Education.
And it's really about getting awareness out there that women should get a plastic surgeon within their time of diagnosis, and then the access to make sure women can get to a plastic surgeon.
Such as board-certified plastic surgeon Robert Whitfield in Austin.
A small breast woman unfortunately develops breast cancer, needs a mastectomy, may need both breasts removed. That's by far the easiest patient for me to get size, shape, symmetry, and projection. So I can use a moderate to larger size implant, almost as if they got a desire of a breast enhancement procedure with their reconstruction. But those are instances where I can really kind of achieve very strong aesthetic goals for them.